This show does not provide medical advice. If you're having a medical emergency, please call 911. Anything you hear here should be discussed with your primary healthcare provider. Hello, and welcome to Everyone Dies, the radio show produced by Passionate World Talk Radio, whose goal it is to educate, enlighten, and entertain. I'm Marianne Matzo, and for the next 30 minutes, I am your host. I have the pleasure today of talking with Polly, who a year and a half ago, July 19 of 2019, had her son, Greg, die from an overdose. And she was telling me, we talked to Chad a bit before we started here, that 192 people die of an overdose every single day. And so we're going to talk a bit about that. And then at the end of our interview, we're going to talk about some work that Polly's doing to help other people who are in this situation. So, Polly, welcome to Everyone Dies.
Thank you, Marianne. It's an honor to be here.
I really appreciate you talking with us a little bit about Greg, because when I heard that Greg had died, it just was a heartbreaking feeling for me, not because I knew Greg, but because I know you and because I know what it is to be a parent. And so the death of a child is a heartbreaking thing, not only for you as a mom, but also for your friends who care about you and can kind of think about, oh my God, how difficult and hard and heartbreaking this is. So what was Greg's story? What happened?
It certainly is heartbreaking, Marianne. There's nothing worse than losing a child at any age. And Greg was just 34 when he died. He is our third son of 4 children, and was probably the most outgoing of anyone I'd ever met. Very engaging and just loved by everyone. He graduated from Vanderbilt with a degree and went on to do business. Was very interested in helping small startup companies get up and running, and was well known for his work in that area and was incredibly successful. He was married in 2011 to his college sweetheart, and had a wonderful home in the D.C. area, and a sweet little boy who was born. He's now 4 years old, and he was almost 3 when Greg died. Mm-hmm. So what had happened was, actually the true story is we don't know what happened. He came to us about 4 years before he died to tell us that he had been using opioids, misusing them. And we had wondered for about 6 months prior to that what was wrong with him. Some days he would be, we'd be talking with him, he'd seem very engaged, and other times he'd seem very disengaged and almost somnolent. Thought maybe he was going through some depression, and encouraged him to get help. Claimed that he was, had been seeing a psychiatrist, but when he came to us, he admitted that, yes, he had a problem, and that he had been using opioids, oxycontin in particular. He was buying it on the street, and he, with his psychiatrist, the first time detoxed himself at home, which he came to us that week after he had detoxed, and said it was the worst thing he'd ever been through. It would never happen again. He didn't know how it happened, and we certainly didn't know either. No one in our family had a history of that we knew of, and we didn't have any record of him, having had trouble with opioids as a young child, like after his wisdom teeth or whatever. Mm-hmm. So that was the beginning of it, and it was devastating, and it was He wanted it kept a secret. He didn't want to tell anyone, including his siblings. And we encouraged him that he needed to share that with them, and that we fell into that whole trap of trying to keep it quiet and act like nothing happened. And for the next 4 years, it was a roller coaster ride of treatment, relapse, treatment, relapse. And his most current treatment that had seemed to be probably the most successful, and he was fortunate to have wonderful insurance and be able to get great help at national centers. We thought he was doing better, but as in the past, every 6 months post treatment, he would relapse. Mm-hmm. And our worst nightmare happened when he was missing for a couple of days. No one knew where he was. He wasn't answering his phone. That had happened once before, and again, it was a relapse, and we got him into more treatment. But this time, we couldn't find him, and unfortunately, they found his body in his car parked in D.C. And of course, that was the worst news any family could get.
Oh, Holly, I'm so sorry.
Yeah, it was hard on my husband and I, horrible, and on his wife. Although the siblings, the kids had struggled. They would go between getting angry with him and being frustrated, like why can't he just get a grip and get over this, to realizing he couldn't. And it's really, I think the most important thing about this is this kind of of death, which is just sudden death, is overwhelming. You don't get a chance to say goodbye. It's really hard on everybody in the family because they all have different relationships with that loved one. And, fortunately, he and his oldest brother, who had some tough words during the course of his relapses, had reconciled beautifully about 6 months before he had died, and I'm eternally grateful for that. Yes, because I can't imagine for families if this happens and that's left undone. So I guess one positive thing in all of this was that that they had that, and he knew he was very, very loved, and he just had a horrible illness, a horrible chronic disease that wasn't treatable. It really wasn't, not unlike cancer. I mean, it was not curable, and it overtook him.
And I was just thinking that in my head, Polly, when you said not unlike cancer, I was thinking in my head, when somebody has a cancer and they go for treatment, and they recur and recur, we don't typically, as family members, get mad at them.
Right.
Right?
Right.
But with a disease like this, it's, I don't want to say natural, but maybe it's natural, or maybe it's just how we're conditioned to think about addiction. We get mad at them, like,
right,
buck up and get this under control, as if they don't want to. Of course they want to.
Right. No one ever grows up saying, I wish I would become an addict. I hope that's what I become someday. This isn't anything anyone wants. And it's so true that, when someone has cancer, everybody rallies around them. People bring dishes to the house of casseroles and, what can we do to help? But yet when this happens, there's this horrible stigma. And there's also this feeling of like, well, why can't they just get over it? Don't they have control over this? Why are they just so weak that they can't get a handle on it. And in fact, people don't realize that this is an illness that you can't control. It's not like you want this to keep happening, but you can't control it. It's a really horrible chronic relapsing illness that has a terrible stigma with it, and that's also makes it even harder because you don't get the support. Loved ones don't get the support they need sometimes when they're going through this.
Did you feel yourself did you get angry with Greg either while he was going through it or after he died?
Oh, sure. I mean, there's a range of emotions. I would be wrong to not say I wouldn't think oh, come on, you're the smartest one that I know. You're, such a sharp kid. You've got so much going for you. What's the matter with you? And then my nurse hat would come back on. I'm like, wait a minute, this kid's got a disease. He can't help this. We just kept saying to him, from the very beginning, this is a chronic illness. Even though when he first came to us, he said, oh, I'm over it. This is it. Never again. And we both, my husband and I, said to him, Greg, you don't realize the power of this illness. It is a chronic disease that you have to manage all of your life. Mm-hmm. Not unlike diabetes and people taking insulin. You're going to have to get treatment all the time for this to keep a lid on it. It's really serious. And then when when we'd have these moments when he'd relapse, and especially when we couldn't find him, and you'd go through anger and fear and worry and oh my gosh, how can this be happening again?
Mm-hmm.
You have all of those emotions, and that makes it really hard as a parent because your job is to love your kid and help them through anything. And of course, as a parent, you always want to be able to put a Band-Aid on it and fix it. But this is something that you can't just put a Band-Aid on, and you can't fix.
And so, how did you, and I'm in no way, indicating that you're through your grief, but in those, even those first 6 months, how did you put one foot in front of the other?
Mm-hmm. Well, I always said I was proud of myself for getting up and showering and getting dressed. That was about it, and especially in the beginning, that was about as much as I could do. We have very strong faith, and that tremendously helped my husband and I. And we have amazing family and friends. I couldn't have done it without all of them. There was no stigma with them, and everyone reached out, including you, Marianne, to tell us how sad they were for us and what a loss this was. And there's nothing anyone can do. There are no words. You can't fix it, but you just you try your best to just get up and get dressed. That was about it in the beginning, and mark off those days. All those firsts were horrible. And then when I got up past the first anniversary, I thought, oh, phew. And I realized the next day, oh, no, it doesn't change. It doesn't matter that there won't, we got past the first. There are still days that are really rough and days that are more hopeful. And one of the things that my kids were able to do that I know we'll talk about later is to find a way to take the anger and the grief and all their feelings and put them into something positive to try to create something that might help others, so that if we can save one, that would be Greg's death won't be in vain. So
why don't you tell us about that? So the kids have gotten together and they're starting something called the Operation Lighthouse, and the website for that is the operationlighthouse.org. And I'll put that address with this radio show. But Holly, can you tell us about that?
Oh, sure. We're so proud of Greg's 3 siblings. He has 2 brothers and a sister, and they all got together and said, we've got to do something. We've got to help other families. And they researched all the resources that were out there, because one of the things that we struggled with every time Greg would relapse is trying to find the best treatment possible for him. And, there's an awful lot of junk out there. They like to prey on vulnerable families and offer you, the promise of cure or whatever when that's not accurate. So they started looking to find best resources, and they found a national not-for-profit called Shatterproof that was founded about 9 years ago by a man who lost his son to addictive disease as well. And their efforts are really on reversing the addiction crisis and ending stigma. They also are really great at advocating to get Congress to promote prevention, treatment, and recovery. And one of the things they've really focused on the past couple of years is offering access to high-quality care. So they've created something called Atlas, which is actually part of their website where anyone can go there, click on it, and actually take a self-assessment to see if, in fact, they do have possibly an addictive disease. And then that leads them to guidance in terms of what kind of treatment would be best available to them. And they have actively researched 6 states and have these first six states, their beginning project is just these 6 states have identified facilities that are high-quality health care. And they also link to SAMHSA, the National Mental Health Organization, so people can get help there if they aren't in those first 6 states. So our kids were so impressed with this, and talking with the board and the team at Shatterproof, and realized that a lot of the work that they're doing is for large companies, educating employers and employees about addictive disease and trying to stop the stigma. But no one is really doing anything for the small companies that maybe don't have great healthcare plans or resources like, even a human resource department where people could go if they had a problem. And Greg's love was working with small startup companies. And so they decided they would work with Greg's former company, QED, which has been so supportive and loving to our whole family, and so appreciative of Greg's talents and strengths, and are excited to be able to pilot and offer education to small startup companies that may not have the resources. And so that's what the Operation Lighthouse project is going to do, to help direct employers and employees of small startups who might be concerned about someone with addictive disease and how to get them the best help possible with the least amount of stigma. And so we're grateful to be partnering with QED, Greg's old company, to be starting this, which, we'll see it really grow next year. We just launched the website. The reason for the name, which is a little unusual, is, as you'll see on the website, our son Greg was incredibly close to my father. Grandpa was, his hero, and my father loved lighthouses. And so my children made sure that Greg was buried with one of my dad's lighthouses. And it seemed like it would be a beacon of light for those who are, seeking help. So hoping we can help those employers and employees in these companies that have these young, brilliant, energetic business folks that are very much at risk for addictive disease because of the kind of work they do and the environment that they're in and the stressors. We want to reach out and try to help them.
So what is it about those small companies that, what you just said, why are they more at risk?
They typically have young employees, and we know, and they typically often work online, not surrounded by support. And of course, in this area, at this time of COVID, that's even worse. But they often can hide their disease by being at home. And we know Greg was able to do a lot of that, working from home and not coming into an office all the time, that they may not someone may not recognize that they need to encourage them to get help. So they are at risk because of the position that they have and the technology world that they are working in. We also know that young population is at, very high risk for addictive disease. I think between, I forget, 18 and 34 or something of that nature. I don't know the exact numbers. I have to look them back up again. But it's a very a population that's very much at risk to be impacted by this. So certainly wanting, and the other concern is that they often don't have a lot in terms of health care. They may not even have, these small startups that might only have 20 employees. They might not even be able to offer them a formal health care plan as they are just starting a company. And not having resources, people are less likely to go get help because they don't have the money to support that. So there's lots of reasons that, and again, Greg's love of working with these young startups, there are lots of reasons that, they need help just as much as the big, large corporations need help.
The reason I asked you that, Polly, is because I never really thought about, that environment as, creating additional stressors, but absolutely what you're saying makes perfect sense. Do you think that the recent opioid lawsuits and that kind of thing will change sort of the addictive environment, if you will, like people having access to medicines or how we prescribe? Do you have any thoughts about that?
Oh, I'm so hopeful that we're going to see a lot of change. It has to change. And unfortunately, right now with COVID, we're seeing an increase in opioid addiction. So, again, because people are home and, are stressed and have mental health issues that sometimes go along with a comorbid condition. But it's exciting to think that, Congress, is certainly pushing for hopefully getting more treatment available for people who need it. We've seen an increase in access to buprenorphine, which is a drug that can be used for people who have opioid addiction to, actually manage the illness, just like insulin would manage diabetes. And we're seeing an increase in laws that are hopefully regulating the use of opioids. Marianne, you and I worked as nurses in an area where, we worked all our life to try to get pain meds for people who had serious and terminal disease. And we found that the pendulum maybe swung a little bit too much in the direction of the excess of these drugs. And so, hoping that the regulations are, reining that in and making sure that physicians are carefully prescribing and providers, nurse practitioners, and CNSs that write scripts for opioids, that they are careful in terms of the volume and the type of drugs they're writing for, and for the, certainly making sure that that those drugs that are out on the streets that are from prescriptions are hopefully the numbers are being reduced. That doesn't help us with the availability of illicit drugs. Greg did die from oxycontin overdose, but the drugs we found out from the autopsy were laced with fentanyl, unknown to him. It's certainly the problem with these street drugs, getting them off the street, that's absolutely critical.
And, it made me realize that one of the lectures or chats I would have with patients working in palliative care was always about them saying to me, well, but I don't want to be addicted.
Right.
I don't want to get addicted. And having to have the chat about the difference between addiction and tolerance and the difference between managing end-of-life pain, related to cancer pain, and, back or toothache pain in a 20-year-old, right? Those are different things. And
very different.
different goals, and one of the reasons we started this podcast was because of, all the different chats I would have with people over and over and over again. I thought we need to be able to educate people about these things so that they can learn for themselves and not be totally dependent on what the clinician is going to have the time to chat with them about.
Right.
And, and so just for the listeners to know that the use of opioids, it's different depending on the disease. It depends on the goals of care. It depends on where you are.
Right.
In your life cycle. It's not just, oh my God, opioids, don't do them, right?
There's absolutely. You and I worked so hard to make sure that people who needed them, especially at end of life, had access to them.
Mm-hmm.
Yeah.
And now they don't want to take them because Well, there's a lot of issues, right? They don't want to take them because they don't want to get addicted, or we write the prescriptions so that they can use them as they need to, but then they can't find a pharmacy to fill them.
Right.
Because the pharmacies are limiting how much of any drug that they get per month. And so if it's at the end of the month, they're out of stock.
Right.
And then, one of those things that you can really get me going on. And then there's also, what patients would report to me, and I don't know if you've had that happen, Polly, where they say, they look at me like I'm a drug addict. Have you heard that?
Yeah.
So here they are emaciated with cancer, and the pharmacist is looking at them like, why are you taking so much of it?
Why are you taking these? Yes, right. And that goes to the stigma, too, of these drugs and addictive disease. And until, we as a nation realize that there is a place for these drugs for people who have, certainly life-limiting illness and horrific pain, but they have to be used safely and carefully and effectively. And, we can't eliminate them, of course. We need them for people that need them, but we have to be wise in how we're prescribing them.
And then the other piece, too, is for the prescribers who are worried they're going to get on a list because they're prescribing so many opioids. Well, if you're a palliative care or hospice practitioner, you're going to be prescribing a lot of those drugs, right?
Right, and that's your job, exactly, yes.
And so, so to have the board then come down on you and say, why are you doing this? It's like, so there's issues much.
Right.
It's huge, right?
Well, and my, like I said, you and I have worked so hard all our career to make sure that these drugs are available to people, and yet to think that this is a drug that took my son's life, we just need to make sure that they're used where they need to be used, that the people that need them can have access to them, and that the people who have addictive disease have access to appropriate treatment so they don't turn to them to fill the holes or the mental illness or anything else that they're dealing with if they're using these drugs to fill.
Well, I really appreciate you being willing to talk about Greg. I know that can't be easy. I know that I don't know that it's heartbreaking, but it hurts my heart that you had this death. And I'm so appreciative to you to talk so that our listeners can learn about this. And I'm really excited about the Operation Lighthouse. And we would be, happy to help you in any way that we can.
Oh, thank you, Marian. I really appreciate you taking the time to ask about it. I know that there are many people out there. As we said, it's certainly, unfortunately, a very common and increasing in the COVID pandemic. And knowing that 1 out of 3 families are impacted by substance use disorder, we've got to get the help to them to be able to certainly, hopefully, eliminate this horrible disease. At least get a better handle on it and get better treatment for it.
Well, my thoughts and prayers are with you and your family, and I want to thank our listeners for spending time with us during this show, Everyone Dies. You can read our blogs and listen to our other podcasts at everyonedies.org. Thank you to our producer, Jeannie White, and our CEO, Lillian Caldwell. We produce a new show every Wednesday to answer questions related to life-threatening illness, dying, and death. Remember, you can listen to Passionate World Talk Radio on Spreaker and our shows wherever you listen to podcasts. If you have a topic you'd like to discuss on our show, please email me at everyonedies.org. So it's Marianne, MARIANNE, at EVERY1dies.org. I hope that you live your best life every day, and remember, every day is a gift. Thank you for listening.